Charlie Andrews depends not just on doctors and nurses, but on the kindness of strangers for his survival.
Somebody was keeping me alive, you know. I'd be dead a long time ago if it wasn't for, donations.
Donations of blood. Leukemia left Charlie's body unable to make new blood cells.
So in essence, I live off of other people's blood. This is transfusion number 95 today that I've had. And I've been in bad shape if I couldn't get it, I can tell you that.
Blood transfusions save 4.5 million people like Charlie each year. But the country's blood supply barely keeps up with the demand. Here in the Memphis area, hospitals need about 100,000 units of blood each year. That's double the national average.
Memphis uses such a large amount of blood due to surgeries and being the 8th largest medical community in the U.S. We use an incredible amount of blood products.
Hospitals depend on the community blood bank, Lifeblood, to keep the blood supply flowing. Lifeblood, in turn, depends on donors. But volunteer donors usually provide just a little more than half the amount of blood that local hospitals need.
So the remainder of that has to come from outside the area to help support the need, which is a major problem for us always.
A major reason for the shortage is that even though 60% of the nation's population is eligible to donate blood, only about 5% does. Increasing the donor level to just 10% would be enough to pull the nation's blood supply from the brink of disaster.
In the event there's some problem where, like in Memphis, if we have an ice storm, we're not going to collect any blood during that period of time. So we need to have a reserve on our shelves. And the same is true for other blood centers around the country. The key to that, though, is having a dedicated donor base, a donor base that's willing to give blood on a frequent basis.
Regular donors like RonGOO of Millington cannot understand why more people don't take the time to do something that's so important.
I know it's something that needs to be done, and so we do it.
Jay Etheridge, who's been a regular donor for several years, even takes a little extra time to donate plasma.
Anyone that's sick or ill or in a bad car crash or has leukemia is going to need blood and going to need help. And when you donate blood, you help them. You donate, some of yourself, and you give, the gift of life.
It's a gift that you can give and that others need year-round, but especially right now.
Blood shortages can occur here in Memphis really throughout the year, but our biggest problems are mid-December to mid to late January. That's when individuals are traveling, businesses are closed, schools are out, etc., so we don't get the donor base we would otherwise.
For donors, the process is relatively painless, easy, and quick. It takes a half hour or less, so it's something that's both easy to do and easy to forget to do. But for recipients like Charlie Andrews and thousands of others, it's a gift of tremendous magnitude.
That's my lifeline. This is it. If I couldn't get the blood, I wouldn't be alive very long at all. I don't know how to express that, but I have no idea where this blood I'm getting today came from. But I'm just thankful that somebody, made it available.
For Smart Medicine, I'm RodSTARNS.
Joining me now is Margaret Ryan, the CEO of the Lifeblood Foundation. Thanks so much for joining us, Margaret.
Oh, I'm happy to be here.
How do you become a blood donor?
Well, it's a very simple thing. All you have to do is be over the age of 17. You have to weigh more than 110 pounds, and you have to be in good health generally.
How often can you give blood?
You can give whole blood every 56 days. Now, once you make that donation and the blood is processed for transfusion, it's good for 42 days. And we, here in the Memphis area, never have a problem of blood sitting on the shelves too long. We are always in need of it. So we really do encourage people who are eligible to come back every 56 days and make that donation.
Tell me how the federal regulations have changed when it comes to donating blood.
Well, back in the 1980s, there were probably about 7 or 8 tests that were performed on a unit of blood before it was processed for transfusion. Today, there are probably more than 24 tests. I think we are very astute, the FDA is, and we therefore are too, about the safety of blood. So it goes through multiple tests, and the whole series of questions that you are asked prior to donating are all regulated by the FDA. And those questions can help you self-select out maybe different types of medication you're on, or different, if you have traveled to certain places in some of the European countries, you may not be eligible for a period of time. If you have a cold, you know, you may feel fine, but that cold may say, no, don't donate today.
If I want to donate, or if I want to have someone come to my place of work, what number should I call?
The best number to call is 901-522-8585.
Thanks so much for joining us.
I'm so
That's
happy
such good
to be
information
here.
and a very important time of year.
Thank you so much.